So Ashley, who is our AAFE faculty member, is treating Claire here, and this is the trick. Now she's bent her needle just a little bit, and you always want to bend it a little bit so you don't weaken that needle here. So that gives her a little better angle when she goes into those tear trough areas here. And that is what she's doing. She's had some Comfortox BLT in this area, and that makes it a fairly comfortable procedure going in. But again, it's an injection, so people will feel some things. But once you get the filler in there, then that filler has got lidocaine in it. You can use any hyaluronic acid, depending on how deep of the tear trough you are filling. That is going to determine the different hyaluronic acid that you may use. In this case, she happens to be using Volbella. You can use Restylane Silk. You can use Bellaterra Balance. You can use, but again, you can use Juvederm Ultra. You can use just about anything as you get into this. These are areas that will bruise. So, consider yourself lucky if you don't get a bruise, but if you always tell the patient that you may get a bruise. Really, real careful injections, very slow injections as you go into these areas. And again, you need to know the placement, and you need to get to an AAFE level 3 master course, because this is an advanced procedure. And I can't say it enough that this is the kind of procedure, if you don't choose the patient correctly or get to someone who knows they've got to know what they're doing. Their injector has got to know what they're doing. If you choose the wrong patient for this, it can be a total disaster. And total disaster means it's very bluish, it's very bruised, it's not filling the groove. These are filling actually very, very nicely, as you can see. And again, this is the perfect case for tear troughs here. So you really need to know the anatomy, number one. That's the one thing we say in the AAFE all the time. Anatomy is key. And you've got to know the anatomy. You never want to get too close to the corner of the eye, to the lacrimal duct. You just want to slowly fill this and know the right tool and the right filler that you're going to go ahead and use to fill this up. And everything is slow. Okay, the injection is slow as you advance. The tip of the injection, that's going to be slow. Certainly you can use a needle, you can use a cannula, you can use any different things. You can be successful with all of it, and you should train in it. And that's, again, in our AAFE Level 3 Master Course, we'll teach you how to use both. And this way, you'll get the best results, but always tell the patient that you may get some bruising here. And what Ashley is doing now actually is, you don't want to get all the way to the corner of the eye, but what you can do, if you know how to manipulate this correctly, is you go ahead and place it into the tear trough and then gently go ahead, not flatten it out, but you can gently move the filler up, to complete that tear trough treatment to an area that it would not be safe with any kind of an injection, whether it's a needle or a cannula here. So we've got a lot of tools to go ahead and do this. But again, as you can see, you can prepare patients. These are very vascular areas. They can get some bruising. Using a cannula does not guarantee no bruising. We've seen bruising many times, so there are advantages to each. This is a very easy, quick treatment, as you can go ahead and see. And you know what? As you go ahead and move her over now, that gives us a really good view from the side. And you can see that whole darkness underneath her eye is pretty much gone at this point on this side here too. Let me just move this around. You can keep where you are too. Just move this around, and so you can see the treatment right there. And it's good, and this is the kind of thing, and this is also what we train you in the AAFE. Don't just look at it straight on. Look at it from different angles, right? And that's what Ashley's doing, which is why she turned the patient's head towards her so she can see it a little bit different angle. She saw something where she wanted to add just a little bit more filler in the tear trough here. So let me just zoom in a little bit. That's looking good. Tiny bit bruised. We're going to put some arnica on there, but that has done the job. That has completely eliminated the dark circles under her eyes. So make sure you get trained and get to level 3 Master AAFE Live Patient Training course in Botox and dermal fillers here. Good job, Ashley.